All right, here we are, Kinesiology 230, Chapter 6, Presentation 3, talking respiratory responses, metabolic, and endocrine responses. We'll be on roughly page 90. We already talked about cardiovascular responses to acute exercise, acute endurance exercise. Now we're going to try to jump into these three in this presentation. So this is Table 6.1. We've already gone through this. I would acquaint myself with some of these. Maybe you need to pause this if you don't have access to the book. You can start looking at like mean arterial pressure. You can look at cardiac output, what happens in terms of increases or decreases during acute response or acute aerobic exercise. And now we're talking respiratory, metabolic, and endocrine. I would also take a moment just to kind of refresh on these as well. So let's get rolling here. Pulmonary minute ventilation, VAV, is the product of breathing rate and tidal volume. And that is to say that we've already talked about tidal volume. It's the amount that you're sucking in and the amount you're blowing out. Well, minute ventilation, pulmonary minute ventilation, is the amount that you're inhaling in and the amount that you're blowing out times the amount of times you do it a minute, the breathing rate. So mathematically, if you look here, you have VAV, or pulmonary minute ventilation, is the breathing rate, how many times you do this per minute, times the total volume. So we get the total amount of air that's moved in and out of the lungs in 1 minute. And we know that this increases when we start to work out. We know that there's a demand for more oxygen, but there's also a demand to also blow off more CO2. And that's on the consumption side of the oxygen, where there's a waste product that we have to blow off. Next section in this area of the chapter, they talk about respiratory quotient. I need you to kind of pay attention to this because there's a little bit of nuance with this and the next section. Respiratory quotient is a ratio of CO2 and O2. And what you have is it's the ratio of the volume of carbon dioxide produced to the amount of oxygen consumed at the cellular level. Now, we can't really measure this. We can't do it, at the cellular level. So what we actually evaluate is the person, the air that they inhale in, which we know that to be a known quantity. That's the air in the room right now, in terms of how much oxygen, how much carbon dioxide, how much nitrogen is in the air. And then we evaluate the air that they pull in, and we evaluate the air that the person blows out through spirometry. And we evaluate that against the known quantity. So we look at this and go, okay, you have the difference between these two is the volume of carbon dioxide that's produced by the muscles. That's a waste product that we know we have when we work out, divided by the volume of oxygen, which is the amount of oxygen that's going into the muscles. So what I want to point out is this is about a volume of CO2 and a volume of oxygen. Now, the book notes that you have respiratory exchange ratio, RER, and they note that there are some subtle differences between RQ and RER, which is respiratory quotient and respiratory exchange ratio, but they don't elaborate too much. I mean, they kind of go in a little bit down here, but because they don't elaborate too much further, I'm not going to elaborate too much further. I'm going to kind of breeze over that, but just realize it's volume of CO2 and volume of oxygen. So let's go ahead and look at this next one. When we look at AVO2 difference, we start talking about people when they work out and they're untrained. When they come in and they work out, there's a limitation to how hard they can work. Now, they might do like sets of 10 on just some selectorized equipment, and they'll do a set on each one as you walk them through and show them this is a shoulder press, this is a chest press, here's a leg curl, here's a leg extension. And they'll become winded. They will be deconditioned enough, and because they're untrained, they will have a cardio-like effect. It won't be true cardiovascular, but it'll be a cardio-like effect where they'll feel winded per se, but it's not classically classified as cardiovascular. So they have built in basically a limitation on what they can do, and they have the inability when they first start working out to be able to actually get to a cardio-like effect that allows the processes to happen that we're talking about. Just as a sidebar. Now, coming back to AVO2 difference. Now, AVO2 diff is the arteriovenous oxygen difference. It represents the extent to which oxygen is removed from the blood as it passes through the body. So we know the red line starts, it's oxygen rich, there's still oxygen and CO2. It goes down through the system, goes through the capillaries, comes back on the blue line, and then you get to the heart itself, and when it gets there, there's still some oxygen in the blood with CO2. AVO2 difference is the difference between how much oxygen is on the red line when it starts and how much oxygen is on the blue line when it gets to the heart, when it ends. Now, normal values are this. On the atrial side, you have 20 milliliters of oxygen per 100 milliliters of blood. On the venous side, you have 14 milliliters of oxygen per 100 milliliters of blood, with the AVO2 diff, normal values at rest, being 6 milliliters of oxygen per 100 milliliters of blood. And as we go through this process, we have these basic differences between the arterial side and the venous side, which we already know because we've already talked about deoxygenated blood coming back through here. And we've already talked about deoxygenated blood being sent to the right atrium, the ventricle, the pulmonary arteries to the lungs back to the veins, left atrium, left ventricle, and then it goes out through the aorta. And the AVO2 difference, really at its most foundational, is how much oxygen is sent out here at the aorta, how much oxygen comes back here and at the superior and inferior vena cava. And that's really what this boils down to. So with these normal values, we know it's about 6 milliliters of oxygen per 100 milliliters of blood, but we know through the Fick equation that when cardiac output, that's Q, meaning increased blood goes out, the AVO2 diff is going to go up. We know that difference is going to happen. We know that the hematocrit levels change. We know that more blood is pumped out. We know there's a higher partial pressure of oxygen that goes out, and a higher partial pressure, a higher amount of oxygen that's used at the muscular level to service the muscles that are actually doing the work. And so this equation tells us that as it goes through this whole process, and the difference that you have between here and here, that difference, that gap between the two actually gets larger. And it gets larger because you have a number of different factors that come into play. I'm going to do my best to say glucagon. I think I just got it out. That's probably my one for the presentation, but that's a word I always have trouble pronouncing. So here we go. With endocrine responses, the purpose of the whole system is to facilitate metabolism and maintain the availability of carbohydrates and fats. You have three primary glands that are noted in the book: the pancreas, the adrenal cortex, and the adrenal medulla. The pancreas. It serves on two different fronts, one of which is through glucagon. It stimulates the increase in plasma glucose concentration, so it kind of increases the amount. And then on the insulin side, it facilitates glucose transport into the cells of the body. So the pancreas, kind of has a twofold component here between the glucagon and the insulin. And one side of it is to create the glucose or have a higher glucose concentration, and the other is to transport that to the cells of the body. Now this I know is going to be a test question somewhere. I've seen it in other classes. I just can't remember where the heck it is. Because the increased metabolic demands of acute exercise, glucagon secretion is increased, whereas insulin secretion is decreased. I remember seeing that somewhere else, but I would kind of wrap myself around that concept in terms of acute increased metabolic demands of acute exercise, as you're probably going to see it again. So any endocrine responses, these are the main ones that they have: the pancreas, the adrenal cortex, the adrenal medulla. These are the main glands that are a function of endocrine responses. Now they're talking about the adrenal cortex, which releases cortisol and plays a direct role in metabolism. And cortisol itself is responsible for stimulating the conversion of proteins to be used by the aerobic system in glycolysis. It helps maintain normal blood sugar levels. I'm just kind of reading this right off here for you guys. And then also promotes the use of fats through beta oxidation. And then exercise intensity affects the level of cortisol secretion. Levels do decrease with low intensity exercises. And so you have this kind of balance that you have when you do exercise and working out in terms of a cortisol response with your people. And it becomes a matter of just managing that process, which is a little bit outside the context of this class, but you're trying to manage your intensity levels in terms of managing cortisol secretion and the stress response that you see that we often talk about in this class with fight or flight. Now we're into the adrenal medulla. The adrenal medulla releases catecholamines, the epinephrine and norepinephrine is kind of that fight or flight that we're talking about. And these are released from the adrenal medulla. And the whole part of this process starts when we start moving. So when we start moving, our body perceives that movement as a fight or flight response, and the SNS, sympathetic nervous system, upregulates. And that's what causes the fight or flight response, and that's what causes the release of the catecholamines, epinephrine and norepinephrine, which causes that fight or flight response. So when you do a workout, you're triggering a low-level fight or flight response. And it's the stressor of exercise that is perceived, and that's where the additional catecholamines are then released. So with exercise, it stimulates the heart to supply blood to the muscles. We got that. We know that. We know also in simple terms that when we start moving, you have this upregulation of the sympathetic nervous system and a downregulation of the parasympathetic nervous system. And that causes some of the endocrine responses that we just talked about, which could be fight or flight or rest or digest. If we upregulate, say, the SNS, then we're going to have fight or flight. If we upregulate rest and digest, is going to be the parasympathetic nervous system. Usually when we start talking working out or we're talking sport activities, we work with athletes and also our clients to find a balance between the SNS and the PNS. So we have a nice balance where a person is being stressed by the workout itself, but not actually stressed because of the workout itself. A little different, right? You want the body to adapt to its stressor, but you don't want your person to be stressed out because of working out. All right, guys, I'm moving on to the next presentation.